This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Hertility 10 tablet is a hormonal therapy used to manage progesterone deficiency. It is effective in alleviating menstrual cramps and symptoms associated with endometriosis. Indications and uses. This medication is used to relieve menstrual pain, manage the symptoms of endometriosis and premenstrual syndrome, and support overall female reproductive health. It is particularly effective for individuals experiencing issues due to low progesterone levels, including irregular periods and signs of menopause. How it works. Hertility 10 tablet works by supplementing the body with progesterone, improving the uterine lining thickness, and helping to alleviate symptoms associated with its deficiency. Directions for use. Take the medication as directed by your healthcare provider. Swallow the tablet with a glass of water without chewing or crushing it. It can be consumed with or without food, and it's advisable to take it at the same time each day to maintain consistency. Your doctor will determine the appropriate dosage based on individual health conditions and requirements. Possible side effects. Common side effects may include severe headaches, nausea, breast tenderness, and irregular periods. If any of these effects persist or worsen, consult a healthcare professional. Precautions and warnings. Use this medication with caution if you have liver or kidney problems, a history of depression, or are planning to conceive. It is contraindicated in patients with specific tumors or blood clots, and individuals should inform their doctor of any pre-existing conditions before starting treatment. FAQs. 1. What is Hertility 10 tablet used for? It is used to manage progesterone deficiency. 2. How should I take it? Swallow the tablet with water, without crushing or chewing. 3. What are the side effects? Common side effects include headaches and nausea. 4. Can I stop taking it if my symptoms improve? No, continue as prescribed by your doctor. 5. Is it safe for children? It should only be used in postpubertal females under medical supervision. Thank you for watching. If you have any questions or suggestions, feel free to leave a comment below. Your feedback is greatly appreciated.